Hi, my name is Paulina and I'm a registered nurse. And today I'm going to be teaching you how to check vital signs. First of all, we need to gather our supplies. We're going to be needing disinfectant wipes. We're going to be needing hand sanitizer, alcohol base. We're going to be needing gloves, thermometer, a stethoscope, a pulse oximeter, a watch, blood pressure cuffs. These two are our manually blood pressure cuffs, and these are our electronic blood pressure cuffs. So first of all, in order to check vital signs, we need to identify our patient. So today we have here our patient. Her name is Irma, and we're gonna be checking her vital signs. Hi Irma, my name is Paulina, and today I'm gonna be checking your vital signs. First, introduce to your patient and let the patient know what are you gonna be doing to the patient. Do you have any questions about checking your vital signs?
No.
Okay, so next we're gonna proceed to wash your hands. We're gonna be using the hand sanitizer, or you can use soap and water to wash your hands. Really good. Rub it all over. Let it dry a little bit until it's dry, and then we're gonna be using our gloves. We're gonna don our gloves. For this patient, for Irma, we're gonna be using her right arm, and then we need to have our arm free of fabric or any fabric. So we're gonna uncover her arm, and then for her size of arm, we're gonna be using this blood pressure cuff, auto cuff. You can see this is our blood pressure cuff. You can see the name is here and the parameters of the diameter is there. So we're gonna be using this and our stethoscope. We can put our stethoscope ready. So first of all, we're gonna palpate her artery. There you go, using our 3 fingers. And we can feel it there. Then we're gonna proceed. Here on your blood pressure cuff, you have an arrow that says artery, and then we're gonna put this on top of our artery. Make sure that your blood pressure cuff is not too tight or too loose. It's really important to place it correctly. Okay, is it too tight or too loose, or it's fine?
It's fine.
Make sure that you always ask your patient if they feel it too loose or too tight. Make sure that our valve is closed. We have here a manometer where we can see. We're gonna put our stethoscope on the ears and place the stethoscope on top of the artery so we can hear. And then we're gonna proceed to inflate. And then, like you can see, we're gonna go up all the way to 150, 160. And then slowly, we're gonna release the air. When we're gonna hear the first loud thump. 125 was the first one. And 75, the last loud one. So her blood pressure is 125/75. So we make sure that all air is out. And then we can remove our manual blood pressure cuff. And then in the meantime, we can use our manually blood pressure cuff to confirm our blood pressure. So this is our manual, this is our electronic blood pressure cuff, and we're gonna follow the instructions again on our cuff. here is a mark of the artery. So this one goes in the middle. We can pulp, relax your arm. Make sure that everything's free. Okay, we pulp your arm again. An artery again, excuse me, and then we place a mark there. We're gonna make sure that it's not too tight, not too loose. How you feel it? Not too tight, not too loose?
Yes, it's good.
So it's fine. Then we're gonna proceed to turn it on. And it's gonna automatic check. In the meantime, we can check her pulse oximeter. We can use the pulse oximeter to check her saturations. So we're gonna turn the pulse oximeter on and use the middle finger of the hand so we can get a reading. Make sure that you use the opposite hand, because if you use the hand that you're using the blood pressure cuff, the blood flow is constricted, so you're not gonna get an accurate reading. So her saturation is 94% and her heart rate is 81. This pulse oximeters can check the saturation and it can check the heart rate. So for her, she's fine. So we're gonna wait to see how much is her blood pressure. In the meantime, we can get the other stuff ready so we can check her temperature, her heart rate, and her respirations. Her blood pressure, it's 127/73 with the electronic blood pressure cuff, and 125/75 with our manual one. So it's pretty much kind of accurate. Okay, so we're done with this. In the meantime, we have this temporal thermometer, so we can check her thermometer, her temperature, 98.2. And then we can use this other thermometer and we can do the axillary. So for this, we can uncover her from this side. Move your arm. Make sure it is off and then put it on and then turn it on. Okay. There you go, relax. In the meantime, we're gonna use our watch to check her heart rate. We're gonna reach out for the artery on the bottom of the thumb, and we're gonna count for 1 minute. In the meantime that you are counting the heart rate, you as well can count the respirations. It's 80. And then our temperature is done. She is 37, we're good. 97 temperature. Heart rate 80, and here we have 80, 81, and saturation 94, and her respirations are 21. So the key of checking everything, it's tricking a little bit the patient when you're doing counting the heart rate or doing the temperature to count the respirations as well. So the patient, if you tell the patient that you're gonna count the respirations, most of the patients tend to hyperventilate, and then you're not gonna get an accurate reading about it. So for this, we're done. Okay, Irma, so we're done checking your vital signs. Okay, thank you.
Thank you.
After you're done checking your vital signs, you're gonna get your wipes and clean all your equipment. And then after you clean all your equipment, really good, get it ready for the next patient. Put everything and let it air dry. After you're done cleaning all your equipment, you take out your gloves and you use hand sanitizer again, and you're done. This is how you check vital signs from my home. Bye.